Welcome to Malignant Myths. I'm Kristiyana.
And I'm Athalia. We are oncologists by day and mythbusters by
All the time.
all the time. Yes, all the time. And on today's episode, we're going to discuss a topic that's rife with misinformation, the menopause. And we're honored to welcome our special guest, Dr. Taylor Hahn, today.
Dr. Taylor, thank you for joining us. Dr. Taylor Hahn is a board certified OBGYN and a certified menopause practitioner through the Menopause Society. She's an active member of ISSWSH, which is the International Society for the Study of Women's Sexual Health. She's the founder and owner of VIA, Women's Health Collective, a direct care women's health practice in Indiana that provides evidence-based midlife and sexual health care. Thank you so much for joining us, Dr. Hahn, and we're
Thank
excited
you.
to talk to you about menopause today.
Thank you so much for having me. These are always really just a treat. So it's basically anytime I can have a time just with fellow colleagues to talk about these types of topics, it's a good day.
Good. Well, let's start then with the very basics. Dr. Hahn, and I'm going to call you Taylor from now on, but
That's
with all due
perfect.
respect, what is the menopause? Can you give us like a definition or a basic place to start?
Yeah. So I think it's really interesting when we talk about menopause, a lot of times we just jump right into all the symptoms and kind of medical things that can happen with menopause. In reality, when we think about the actual definition, it is essentially one day of your life, which is 12 months from the first day of your last period. So it's in terms of a medical definition, it's a 1 day description. And then we talk about it in terms of what happens before and after. And so I think it's important to kind of delineate that there are symptoms and things that can happen before that 1 day and very much so after that day too.
Oh, wow. I had no idea there was like one day that you could put on your calendar as like this was D-Day or M-Day,
Yeah.
I guess, and then like celebrate it or commiserate it as a birthday
Yes.
once per year.
Yeah, and the tough part is that it's always going to be a retrospective type of
Right.
epiphany where you're like, oh yeah, it has been 12 months. So
Last Tuesday.
yes.
One thing I was really keen to ask you was about the sort of hereditary component of menopause. Like, does having a bad menopause run in the family? Because I'm remembering some periods of my teenage years where my mother's behavior, I really hope she's not going to listen to this episode, was mildly erratic, shall I say? And of
Yeah.
course, at the time, I was, completely clueless and wasn't paying attention to any of these things. But in retrospect, I do wonder.
I do think that a lot of the symptoms and particularly the timing does tend to run in families. So that's one of the first questions that I sometimes will ask patients if they're not quite sure if they're in perimenopause or if they're reaching that time point is, well, when did your mom go through menopause? When did your
Mhm.
grandmother go through menopause? The interesting thing is, and I'm so glad that we're at least starting to have those conversations even generationally now, is that there's not a lot of actual data about that because we just generations have not been talking about it. I think we're sort of coming into this age where it's much less taboo to talk about these topics and everything that happens with your body through menopause. But I think a lot of our mothers and grandmothers would probably say, oh, well, that's not something we ever talked about. You just kind of did the grin and bear it thing.
So is it something that we then just have to suffer through, or, is it something that we can take active steps for?
Absolutely. I am very big about being proactive, not just about treating, but just understanding what to expect as you approach that time period. We talk about it in terms of, a lot of people say, oh, well, I've just now started to have irregular periods or irregular cycles. So now that's my telltale sign. But really, for a lot of patients, they're having symptoms for several years before that, before they ever start having any kind of sign that something has changed with their cycles.
What kind of symptoms? Are there common ones that people don't sort of attribute and actually they are to do with the perimenopause?
Yeah, so probably some of the most common ones that patients think about or have probably heard other friends or family members talk about are the hot flashes, the night sweats, or soaking your bed sheets, definitely leading to difficulty with sleep. Or I like to call it the 2 a.m. awakening, where you're just ruminating on things while you stare at the ceiling. Um, uh, Definitely, vulvar vaginal symptoms are a huge component. And a lot of times, I think patients don't realize that that can be actually one of the first signs that things are changing, because your tissue health overall changes. You might get drier skin as well, and that drier skin can be everywhere. Just different changes in mood, fatigue level. And then I hear a lot from patients in terms of concerns for libido and just interest in sex as well.
But it must be quite confusing because so many of those symptoms can be caused by other things, dry skin, hypothyroid, or depression and anxiety can cause difficulty with sleeping. And so how, I'm imagining
Yes.
someone in their 20s or early 30s that is still ovulating regularly, having regular periods, and is nowhere near perimenopause, thinking, oh gosh, maybe I am. Maybe this is the start. Maybe I'm having a premature menopause. What can you do to reassure yourself that these symptoms aren't due to the menopause?
I think you made a really good point in that is, I think that's part of the reason why these symptoms they go unaddressed for many years sometimes,
Mm.
because they can sort of mimic other things, and those things that concerns that you might take to a medical provider, that medical provider might not be very experienced as in terms of pinpointing perimenopause symptoms or menopause, and then also actually treating and knowing the options for treatment. So a lot of my patients come to me and they're already on an antidepressant or an anti-anxiety medication, but they still are having symptoms and still, experiencing even a worsening, even though they've been started on something. So I think just knowing for patients that they that there are specialists out there who have a special interest in it and a passion for really the education component, not just while you're actually experiencing those symptoms, but also before, and then following you and walking with you after as well.
Mm. I suppose that another reason for this sort of uncertainty about whether it is or it isn't due to the menopause is the sort of stigma and, sort of cultural science. People don't talk to each other. Women don't talk to each other about a lot of these symptoms because of various other stigmas surrounding, mental health or whatever. And I'm sure with the menopause, there's a huge amount of that because it's sort of seen as something, it's the end of your ability to reproduce. Some people might see it as a failure, as an end of this period where you could be productive, in terms of
Yes.
children. Where did that come from? Is that just the patriarchy?
I think partially, probably yes. I think also it's just it is very tough to sort of wrestle with the end of something that was sort of consistent for you, and trying to figure out where do you go from here, or how do you move forward from here. And because women have tended to just kind of grin and bear it and not talk about it, you see them experience, and I tell my patients, you don't have to be just existing in a low level of misery for the rest of your life. There are so many ways that women can take this time period and really improve on their overall health. I think we tend to be a little bit more in tune with that whenever we start to experience those symptoms. And so there's a lot of ways that we can really take this time period of life and say, no, I'm going to do something amazing with it. I'm not just going to suffer, and also not talk about it with anyone, because there is definitely help that's out there.
Taylor, when you were going through all of the symptoms, I can definitely, in the back of my head, I was like, oh, I check off a lot of those boxes. And I've been thinking myself about hormone replacement therapy. Can you share a little bit about the safety and the effectiveness of hormone replacement therapy?
Yeah, yeah, absolutely. So I think a lot of us have probably had some experience or another with hormones in some way, whether that is with birth control at an earlier age, pregnancy with hormone fluctuations. And so I think of menopause hormone therapy as sort of more of like getting you just back to a nice solid foundation. In comparison to when we think about birth control pills, that is really high dose of synthetic, typically hormone, that is meant to really sort of interrupt the normal ovarian cycle, and that's how we prevent pregnancy. Menopause hormone therapy is typically much gentler on the system, and it's really meant to help with just control of some of those symptoms that can happen with the wild fluctuations of hormones. Safety wise, I'm sure have all kind of heard the back and forth and a lot of controversy over, well, is hormone therapy safe for me or is it not? Is it going to cause cancer or is it not? And I think the overwhelming practitioners now would tell you that it's all going to be individualized, but for the large majority of patients, particularly starting it within a certain time frame, it can be very beneficial and it's a very safe option for treatment.
Well, that's good to know that some of this controversy is becoming more clear, at least. And like you said, there is an individualized approach. And so it's good to know that there are options out there, and there are ways to treat
Absolutely.
symptoms when those arise. And so we don't have to suffer through those symptoms.
Yes.
Um, and can you talk a little bit about how the media portrays menopause?
I actually have kind of been sort of excited about how the media is starting to talk about menopause. I mean, if you'd asked me this like 2, 3, 4, 5 years ago, I would have said, oh, I mean, menopause in the mainstream media is portrayed as you should just like go out to pasture and just you're not really a functional part of society anymore, and sort of you just get put by the wayside. And now I think we're having so many more conversations about the actual changes that happen in the body, and from a biological perspective, from a medical perspective, that the general public, I think, is really embracing this concept like, oh my gosh, that explains so much. And honestly, wish I would have known that, whether it's a teenager or a 20-year-old versus a spouse or a partner. They're now able to have access to more information to be able to say, oh my gosh, I wish I would have known that before so that I could have also been more helpful and understanding too. So I do like the direction that the discussion with menopause is going. I think we have a lot of work to do still, just about, I still have patients daily who come in with the fears that we talked about before. But I think I love that we're at least starting that conversation so much earlier now.
I think in in sitcoms of the past, the menopausal or perimenopausal woman has been the object of a joke. There's a
Yes.
sketch, she starts sweating, there's a big like laugh about how it's the change or it's not, or
Yes.
and I wonder if um, you know we as a society can do something akin to how the issue of same-sex relationships and same-sex marriage happened in the media. It was very early that sitcoms were a way to introduce ideas that a lot of Americans wouldn't have come across before, and it
Yes.
really helped change, shows like the Ellen DeGeneres Show, and other
Yes.
characters appearing on like very mainstream soap operas and telenovelas really changed the narrative on that
Yes.
issue. And I wish it would be the same for the menopause. Maybe that's something that the big TV execs can consult you on after hearing this podcast.
Well, I think that they're starting to do that. I've seen even a couple of times where, hormone therapy is actually like shown. Probably the earliest one that I can, at least for most of the listeners, probably know of is Sex and the City. And where they're actively using hormone therapy there. It was still even very taboo whenever that episode came out and whenever that portion of the show really highlighted that. But I do think that showing that it was, a highly professional, really engaged female who was having all of these symptoms at work and then trying to navigate that. I think we're going to start seeing that more because I have seen it in a couple of like films and then a few television shows as well. But yes, I would love to see that as just and more of a real interpretation, like show the fact that this woman who's like powerhouse success, but also has a presentation to do in 10 minutes and has soaked through 2 shirts, show the parts where you get the brain fog and you can't find and the word finding gets harder and harder. So I think we're going to start to see that, and I'm excited for that time.
It's definitely great to see that we're talking more about menopause. There was the recent FDA expert panel on the pros and cons of hormone replacement
Yes.
therapy that was publicly available to listen to. To me, that was a great sign that this is an important public health topic that everyone is talking about now.
Oh my gosh, I was like watching it intently with like popcorn. Like, oh my gosh, what are they gonna say? So, no, I love that it's finally getting some national attention and garnering that assistance. I'm just hopeful that that wave will continue to move forward. And particularly when it comes to just research and development and really making that a priority for overall women's health and longevity.
Taylor, are there any demographic characteristics that make the menopause experience different for different women? For example, race or socioeconomic status or cultural background?
Absolutely. So we know that Black or African American women, they oftentimes tend to experience perimenopause symptoms earlier and also for longer, both before and after that menopause day. And I think also just historically, that same population may not express that to their medical provider. So they're more likely to also not necessarily get the treatment that is available to them as well. Same thing with, when we think about lower socioeconomic status, I mean, just trying to get the access. I think the tough conversation I have with my patients a lot is that these medications, sometimes your insurance has chosen one single type of hormone therapy. A lot of times it's a local hormone therapy versus actual systemic hormone therapy. And so then you have to justify when you prescribe something different, why you're prescribing it. And you all know, but it's called prior authorization. It's the most fun part of medicine in the United States. But some of those patients don't, even if they see a provider who wants to prescribe for them, a lot of them may not have coverage to actually afford the medications that we prescribe.
And on the flip side of that, there are patients that are being preyed upon, I feel like, by kind of charlatan, kind of quack providers who, I see it on social media. Your phone listens to you when you're talking about things. So in the run up
Yes.
to this podcast, I was, reading up, and then all of a sudden I'm being advertised on Instagram or Facebook, take this supplement or that supplement. And with the misinformation that's out there, and then the lack of, um, exposure to good information in this area, it's no wonder that people end up seeking help in, like, sort of these sort of alternative clinics. I wondered if you could speak to that, because I'm sure that there are providers that are providing great kind of holistic and sort of a natural focused healthcare, but that there are
Yes.
also a component of people that are being taken advantage of.
Yeah, and I think the Menopause Society does a really great job of kind of reiterating this, that even the options for FDA approved hormone therapy or kind of government approved hormone therapy, that's actually been quality controlled. It's been tested for consistency of dosing. That is all still bioidentical. And so I think there's been this sort of marketing ploy of bioidentical hormone replacement therapy versus hormone therapy. They're the same. So I think that's usually the first place that I sort of start the conversation with patients, that you don't have to pay hundreds and sometimes thousands of dollars for these hormone therapy treatments for your symptoms related to menopause. They're overall very affordable. And there are ways that we try to also find, discounts and additional ways that we can help support patients in that way. But I agree with you. There are a lot of places that are sort of preying on kind of the desperation of patients who have maybe even been to several providers, who have sort of and then felt dismissed, or felt like they weren't getting all of the answers or all of the options discussed. And I talk about that in terms of a lot of my colleagues sometimes have 5 to 7 minutes with a patient, like when they actually get to sit down and talk with them. And that is just not enough time to cover all of the aspects of menopause care. And so I really feel for them, because I think it's kind of a vicious cycle that we go through.
For sure. And, along those lines of various things that are available to patients, and because of course the list is now fortunately long, I wondered if you could talk a little bit about some of the non-hormonal approaches, whether that's, supplements, diet, exercise, other things that people can do to help alleviate their symptoms, and how they,
Yeah.
if they're backed by actual evidence, or if it's just this probably won't hurt you kind of situation.
Yeah, there are a few non-hormonal options that have reasonable data to back them up. We talked earlier, I had mentioned that a lot of my patients come already on an antidepressant. There are actual studies that show that there are a couple of different antidepressant options, that one of which is FDA approved in a slightly lower dose, but that actually have shown to be beneficial, particularly for the vasomotor symptoms of menopause. So those hot flashes, the night sweats, or kind of feeling like creepy crawlies on your skin. So those types of symptoms can be helped with that. There's also newer medications that are sort of targeted toward the actual kind of pathophysiology, like neurologic type of changes that happen with vasomotor symptoms. And so those are probably the newest drug class out there, probably still a little more expensive, unless we can kind of work well in the sandbox with insurance and get coverage. But really excited about those medication options, because I think we're only going to see research actually continue down that line. And I think it's a great option, particularly for my patients who are survivors of different types of cancers, but particularly breast cancer.
So along those lines, are there any medications or treatments that patients have come to see you and they said that they've tried or they've been taking that you're like, no way, stop this. This is either not going to be helping you at all or potentially doing you harm?
Um, I I can't necessarily say that there's a lot that's like, oh my gosh. Now, if they're taking a large range of supplements, I usually go one by one through the supplements. And sometimes, I mean, patients sometimes are taking upwards of 15 to 20 supplements. When we could
Expensive.
potentially correct. It's so expensive.
Mm.
And for probably at least half of those, if not a majority of them, they actually don't really know why they're taking them. And that's just that, and that's not speaking ill of patients. It's really just that, they, once again, maybe they saw an ad or something on Instagram or TikTok, and they were like, I might as well try it. I've tried everything else
Yeah.
at this point. So they start it, but maybe they're taking one supplement and they're already taking two other supplements that were supposed to be doing the same thing. So
Mm.
I usually try to sort of go through that entire list with my patients and say, okay, why are you taking this? Like, what's your overall goal for it? Are you treating a deficiency of some kind, or could we reasonably take this one out? And so it's nice to be able to kind of have that open conversation with patients in kind of a no judgment or judgment free zone. So because again, people are just trying to feel better.
Yeah,
So
absolutely. And I'm going to change the tack just a little bit and ask you a question about, well, I wouldn't say politics, but the issue that we find ourselves in these days is funding for research. And this menopause doesn't exist in an island; it exists in an entire ocean of women's health
mhm.
funding. And I wondered if you could speak a little bit um, to how you feel the field needs to go and why the government or research funders need to focus on menopause. Is it just making women feel better, or is it really more critical for other reasons?
No, I love that you asked that question. So I think the biggest point that I would hit home about perimenopause and menopause is that there are so many other medical changes and biological changes that happen with the body through the menopause transition and then for the years beyond. So we're not just talking about making you feel better or getting rid of an occasional little hot flash. We're talking about trying to decrease risks of from like fractures for bone, so decreasing risk of osteoporosis. We're talking about better monitoring and better data as in terms of cardiovascular disease, the number one killer for women. Making sure that we understand that concept and how hormone therapy may or may not play a role for some patients in that. But there's so many actual medical changes that happen through menopause. So it's really trying to improve life and improve longevity, and an actual health span for patients as well.
I guess it's also a great opportunity to bring people back into a regular relationship with a qualified healthcare provider that is also at a time of life where you begin to be more at risk of things like heart diseases and cancer, and other reasons why you might want to start building a steady relationship with a provider that can keep an eye out for those things with you in the future.
Absolutely. I think it's still very important to have an actual healthcare team, right? So that nobody is just seeing one single provider for all of their healthcare needs. I think it's still very important to have a team. But you also need somebody who's going to look at you holistically and not say, that's not my problem. You need to go see someone else. That's probably one of my least favorite things to hear come out of another provider's mouth is it's not that it's not your problem. Maybe you don't feel comfortable caring for it. So let's find you someone who does. And let me at least be sort of an advocate for you in trying to navigate the healthcare system with that.
Taylor, you're such a wealth of knowledge. How easy is it for patients across the country to find a certified menopause practitioner? Uh, Not every OBGYN has those deep expertise. Can you talk a little bit about access to that specific
Yeah,
skill set?
absolutely. So I would tell everyone to probably visit first the Menopause Society website. There is, I want to say it's menopause.org, but they have an actual find a provider portion to their website. So you can look up anyone who is actually certified through the Menopause Society. They're internationally known to be the expert body for, or one of the expert bodies for all things related to menopause and midlife care. Um, the other portion, or the other website that I would say is a good find a provider website is the ISWISH website, so the International Society for the Study of Women's Sexual Health.
Okay.
Many of the providers in one or the other sort of have overlap at both, because they do tend to run together. I have so many patients who maybe say that they're coming to see me for menopause, but it's actually primarily a sexual health issue, or vice
Okay.
versa. And so it's been really nice to be able to care for both sides of that coin.
Very much related in some
Yes.
instances. And so we talked a little bit about how excited we are that there's more talk on menopause and it's becoming more accepted in society. What do you think it would take to normalize menopause similar to healthcare issues like menstruation or mental health?
Gosh, I actually almost feel like menopause is becoming more normalized than menstruation, which is really kind of depressing. But because I think there's still so much taboo around just like, especially girls and young girls who start menstruating, and sort of helping them navigate that. Particularly in the time of social media. So, because there's a lot of stuff out there, a lot of content out there that's related to that. But I think just trying to sort of normalize the conversation really takes just a lot of us continuing to have these conversations like this. So, not just, an influencer or somebody having that putting out that content, but actual medical professionals too, being comfortable saying, hey, we might not have every single answer for you, right? But here is where we want to balance helping you feel better and helping your overall health with what our data actually shows. So, and I think trying to find a good balance with that is going to really be what we as medical professionals are called upon to do in the next few years for sure.
Absolutely. Are there any books or educational materials or other resources that you would recommend for our listeners if they wanted to learn more about menopause or hormone
Yeah,
replacement therapy?
I looked up the website, menopause.org. I Googled it while we were talking. So
great.
building on that
Great.
answer.
I love it. I love it. So they actually have some pretty good patient handouts on that website as well. So lots of good content there. They are all over socials as well. So I think that there are several like certified menopause practitioners that are also pretty active on social media as well, that I think are fantastic resources. Probably a lot of us have heard, because I think she's sort of nationally or maybe even internationally known now. But Dr. Mary Claire Haver is a great resource. The physicians, I also work through Alloy Health. So lots of all certified menopause practitioners there as well. And so there's lots of different options for physician content there too. Who else? Gosh, Rachel Rubin, Heather Hirsch, Lisa Larkin, like lots of medical professionals who I really respect and really think that they put out really great educational content for patients, and not necessarily in a way that's like, if you're doing something different, you're doing it wrong kind of thing, but really just trying to reiterate like, hey, it's most important that we're all just having this conversation. So let's actually keep talking about it, keep answering questions. And if there are questions that come up that nobody knows the answer to, like that's where we target to move forward with research as well.
Taylor, is there anything else you wanted to share today that we didn't touch on the topic of menopause?
I think just reiterating to patients that that they're not alone, and that you can listen to podcast after podcast, you can read, you can look at social media posts and everything, but advocate for yourself. Like, so see your medical provider, and really you can be choosy in this particular situation. Like we want you to be choosy as far as who you see. And it's okay to ask questions to your medical provider. And if they sort of hem and haw and don't necessarily give you a straight answer, or what would be better is if they said, I don't have expertise in that, but I want to help you get the care that you need. Then it's okay. Like that doesn't mean that they're a bad provider either. It just means that you need someone else on your healthcare team to help guide you.
Seems like a great place to wrap things up. Thank you so much, Dr. Taylor Hahn, for coming on the show today. We're going to link to a lot of the resources that you recommended on the website and attached to this podcast so that the listeners can click through on those. So thank you so much.
Thank you all so much for having me. This is so fun.
Thank you so much for joining.
See you all next time.